Good day, my dear undergraduate students. Welcome to OMG 2 minutes. Leukemioid reaction. The definition is it is a lesion mimicking a leukemia in a patient who is not suffering from leukemia. There are two types. One is the myeloid leukemioid reaction, the other is lymphoid leukemioid reaction. Myeloid usually in any bacterial infection. It can be there. Lymphoid, on the contrary, it will be in viral infections. Now, basically, what will be the diagnostic problem? It can mimic a leukemia and therefore it has to be differentiated. However, there will be clinical and radiological differences. The patient may also be having some lymph node enlargement and this should not be confused. The percentage of blasts is only slightly increased, maybe 1 or 2%. And the lab score is raised in this, unlike the acute leukemias. This is an important tabular column which you people shall and will memorize. You can answer in a number of questions. The clinical features, you will be finding the underlying disease. In leukemia, there can be splenomegaly or lymph node enlargement. Blood count is less than 1 lakh. Here it can very easily be more than 1 lakh. Blast cells, occasional leukemioid, it will be more than 5% in CM. And it goes in for 20% in a case of blast crisis. White cell morphology, toxic granules will be seen. Whereas here, immature atypical cells can be seen. You will be finding all the precursors of the neutrophils. Anemia not significant, moderate. Platelets normal, decreased except in a case of CML. Bone marrow shows a leukocytic hyperplasia. It shows immature cells. And at autopsy, the changes due to the original disease is seen in leukemioid reaction, whereas not much is found out in a case of leukemia. Other changes such as ECG, culture and sensitivity, X-ray, etc. will be positive in leukemioid and not so in leukemia. Lab score is increased in leukemioid reaction, more than 140. Here it is decreased. This is a must know and we shall remember. This is a picture that we have got. On one side, I am finding neutrophilia. These are the neutrophils which are having segmented nuclei and they have got toxic granules. But all are neutrophils. In a case of leukemioid reaction, the count is markedly increased. Look at this particular cell, a C-shaped cell. It is more of a stab form or a metamyelocyte. This can be a myelocyte, whereas mature neutrophils are also seen. But there are hardly any blasts in this. Platelets will be normal in a case of leukemioid reaction. That brings us to the end of this class.